Hey guys, it's Dr. Tanner coming at you here. I am coming at you from our IV suite. I just wanted to remind you, we've got this great speaker coming up. You're going to love it. Super exciting, really cool info, all like hands-on things you could implement into your life today. But I wanted to remind you at the end of the summit that you could link in, and I want you to have access to those bonus materials that these people are providing. It's really valuable information. So don't forget to link into that. I also want to let you know that I am here to help. I am happy to work with you, to help you with your health concerns, to help you with your performance. You can find me and have access to me, Dr. Tanner, at www.run-lab.ca. So that's run-lab.ca. You can link in there. You can find out how to work with me. Enjoy the summit. It's going to be a lot of fun. Hello, runners. I am Dr. Jennifer Tanner. I am the host of the Run Well Summits, and today we have Caroline Myer with us, a very special guest. So Dr. Caroline Myer, she's a naturopathic doctor who's convinced that getting sleep and better recovery not only improves your sports performance, but optimizes the overall enjoyment of your life. Dr. Caroline, she is a longtime practitioner of meditation. She knows how mindfulness practices can not only transform the mind, but all aspects of your health. So she is here today to see how we can incorporate some of those aspects into our run and get us a better energy levels. So Caroline, tell us a little bit about yourself. Do you have a story to tell?
I do have a bit of a story, actually, Jen, and thanks for inviting me on to the summit. This is a topic I'm very passionate about, and that passion really comes from personal experience. Throughout my life, since childhood, I've had bouts of pretty severe sleep problems and always managed to deal with them. But then I hit my sort of late 40s. My professional life was very satisfying, seeing patients in private practice, teaching, but my personal life imploded. I sat by my father's bedside as he died of congestive heart failure. Then, that was threw me into obviously deep grief. And then within 2 years of that, my relationship of over 24 years ended shockingly, not by my choice. And so that was another grief kind of layered in. And then a year after that, my sister passed away very suddenly. And at the same time, I'm in my late 40s, going through perimenopause. My hormones are going all over the place. Probably some of your listeners can relate to that. And guess what?
That was happening at the same time.
just to add another layer in there. And guess what? I just stopped sleeping well, and I would spend many nights, up for 2-3 hours, making amazing to-do lists, solving the world's problems, not sleeping. Where I would get to sleep and then wake up at 3 or 4 a.m. and have a really hard time getting back to sleep. So, and it really impacted my life in every way. It really, and people who've, suffered from sleep deprivation could probably relate. It just sucked all the joy out of my life, and everything seemed like drudgery. And so as a naturopathic doctor, of course, I have lots of tools to deal with this. So I pulled in a lot of different tools. I also sought advice from another naturopath, went to see them, got acupuncture, did therapy. And so over time, gradually, my sleep really improved. And from doing a lot of different things, I really honed it down into sort of the few essential practices that I know that really help me just really dial in my sleep. And I can say that not every night is perfect, but most nights I sleep. I say to my patients, kind of joke, I sleep better than a baby, because everyone says I'll sleep like a baby, but
babies don't sleep that well.
And it's improved my life. Yeah, it's like that joie de vivre is back.
Yes, I like that you touched on. You said that it's not perfect. I think our goal should not be perfection, but should be progress, right? And that when you're looking at that progress, it's like similar to the stock market. Like it's generally going up, but we've got these like lumps and bumps along the way. Like you said, you had deaths and you had breakups and you had like life happens to us.
Yeah, exactly.
Have those strategies in place to be able to adapt to it. So what were some of the strategies that you used to get you through all of this?
Some of the strategies, what I really learned a lot about was the importance of respecting my circadian rhythms.
Okay.
and developing routines on my daily basis that really supported my sleep, rest, recovery, and making that a priority. Without, I think for people who've suffered from sleep problems, you kind of lose that confidence in getting good sleep. So, as the night rolls on, you get closer to that sleep time. You're kind of like, oh, am I going to have another terrible night of sleep?
Mm,
But really trying to turn that around. So I actually have a lot of agency and control over how I structure my day.
okay.
So I'm a big fan of Dr. Michael Boyce. He's written a book called The Power of When. Well, it's probably
Oh,
backwards in there.
okay, good. Yeah.
It's a really great resource about finding out what your chronotype is. So
Okay.
he's a clinical psychologist who specializes in sleep medicine and found that there's sort of 4 chronotypes. And I was certainly convinced that I was a dolphin. And dolphins are the terrible light sleepers. Always part of their brain is always on, even in sleep.
Okay.
But it was interesting when I did his quiz, which you can access online for free. I found that I was actually a bear. I was actually sort of the average person who sleeps generally well, unless terribly stressed, and kind of needs to sleep around from 11 p.m. to 7 a.m. So I really prioritized. Okay, I'm really going to try to get 8 hours of sleep,
Okay.
regardless of what's going on in my life.
Hmm.
Also, I think the importance of managing that light and darkness. So
Mm,
getting blue light early in the day, and there's lots of research showing that that's really important. Blue light is not your friend in the evening, but is definitely an ally for getting good sleep
so
later that day.
what would be an
So
example of blue light?
blue light is sunlight. So, or you can, if you're living in a gloomy place or a place north of the equator, you can use a sun lamp, and that's what I would use often in the winter, just for
Mm,
20 minutes. You don't need to be outside. I mean, it's obviously great if you can be outside for longer, but 20
yeah.
minutes of blue light exposure is really helpful.
So that sun
Um,
lamp, you could just have that at your desk while at work or at home, kind of while you're
yeah,
reading a book or
yeah,
something.
exactly. I
20
sort of
minutes.
put it on my breakfast nook and just have it. Obviously, like the sun, you don't want to look straight into the sun lamp,
Okay.
but just sort of have it on the side so it's your eyes are getting exposure to the blue light
Okay.
and early in the day. So ideally, sort of before 10 o'clock.
Okay.
Obviously, if you do a morning run, if it's
Yeah.
not before sunrise, then that's a nice way to kind of combine some exercise with the blue light.
Okay.
Blue
Yeah.
light in the evening is not great, and
It's
that's
not
what
your friend.
it's not
Okay.
your friend if you want to sleep well.
Okay.
And unfortunately, we're inundated with blue light because
Mhm.
LED lights, emit a lot of blue light,
Oh,
fluorescent light.
yes. Okay.
All the electronic devices, unless you adjust them, do emit quite a bit of blue light. And
Okay.
that will interrupt your melatonin secretion, which is a hormone related to sleep. And lots of research showing that if you expose yourself to blue light, even small amounts, it's kind of scary. It doesn't even have to be a lot.
Hmm.
It can really interfere with sleep onset and quality of your sleep.
Okay. So on my, just say I'm using my cell phone at nighttime, I can decrease the brightness of it,
Yes.
and that will help me reduce some
Yeah.
of that blue light exposure. And like same with my laptop and whatnot, those sorts of things
Exactly.
would help.
Yes, they would
Yeah.
definitely help. And as well as, I always try to keep my ambient lighting at night kind of dark. So my home's pretty dark at night. I don't
Yeah.
have all the lights on. And yeah, certainly. And then I also have these sort of kind of cool blue blocking glasses. So you can buy those like on Amazon or if you do want to use your, say, tablet to read a book while you're
Okay.
in bed. So that
Okay.
will also block blue light as well.
So what
Um,
is it with the like making your house darker at nighttime? What does that do to your hormones?
with your hormones, it's a signal that to your brain to produce melatonin, and
Okay.
melatonin naturally gets us into sleep more easily and helps us to stay asleep. And
Okay.
oftentimes, if the blue light will interfere that release of melatonin,
Okay.
so it's pretty important. And other studies have shown too that for people who do have like a circadian rhythm disorder, where they cannot get to sleep till much later at night, you can just send them out to the woods, go camping for a week or 10 days, and just
Yes.
live with natural light, and their circadian rhythm disorder is oftentimes just resolved.
Just
So
resolve on its own.
there's that power.
Yeah.
Right.
It sounds like certainly living in a city, a big metropolis, this can have a
Yeah.
big impact on those light dark cycles because it's potentially never dark in a city, right? We've got all
Oh,
the
never.
sounds and lights and exposure and excitement and things that are like delaying those onsets of melatonin and keeping your nervous systems like very active. So
Yeah.
mimicking those dark cycles in your house is a great way to start
Yeah.
removing some of those external influences that our
Yeah.
society might be having on us with all the lights, the lights
And
and
keeping
brights.
your, yeah, and keeping your bedroom dark is important,
Yeah.
because there are those, yeah, and if you keep your electronics, I have so many teenagers in my practice, for example, it's like, oh, I need my phone in by my bedside because it's my
Okay.
alarm clock. And it's like, well, why don't
Yes.
you just get an alarm clock and
Yeah.
keep your
Like
phone out of the bed?
1999, you could probably pick up a decent alarm clock
Yeah, yeah,
to replace that.
um,
Okay.
yeah,
Yeah. So there are
non-LED,
solutions to these
just for
obstacles here.
everything. Yeah. But it
Okay.
is true. There's a lot of light pollution in urban settings that you do it's important to manage.
Yeah. Okay. Um, in your opinion, is it sleep is one of the things that's leading us towards the burnout and that lack of energy?
Yeah, definitely. I think sleep is probably the number one recovery tool that whether you're a recreational athlete or, elite performer,
Okay.
prioritizing sleep is really important. Probably more so if you're tending towards the burnout stage, you'll find, yeah, that sleeping 10, even 12 hours in a 24-hour period can be very healing. Obviously, it impacts your life. That's like half of your life for a while.
Yeah.
Um, and elite performers as well, that they tend to need a little bit more sleep and rest, especially when they're doing heavier loads of training.
Yeah, if you do a quick Google search of any of the like pros, a lot of them are sleeping 11 hours. Like they're getting like they're working out, they're napping, they're sleeping, they're
Yeah,
working out. There's way more sleep cycles than the average person would be getting. Their energy
yeah,
expenditures is huge. And we tend to, especially people like getting into fitness, we tend to just keep pushing through and not
mhm.
and kind of don't get those body signals that, hey, you might be a little more tired and burnt out.
Yeah. You can skip the workout today and, go
Yeah.
hard the next day, or
Okay.
yeah, maybe
Okay.
less is more.
And would you say 8 hours is a bit of a magic number there?
Yeah, I would say the research would say 7 to 9 is the sweet spot. So eight
Okay.
is right in the middle of that.
Hmm.
It is an experiment. So you really, some days you'll have 7 hours and just see how you feel. There are obviously there's outliers, people who really do run well on 6 hours of sleep, or people who need more.
Yeah.
But I would say 7 to 9 is sort of the range you're aiming for.
Okay.
Yeah. And consistency. So not necessarily getting 6 hours, then 10 hours the next night to make up for it. Because it kind of creates a little bit of like artificial jet lag,
Mm,
which can, again, going back to the circadian rhythm, can really negatively impact your sleep.
okay.
So yeah, sometimes people will stay up a lot later on the weekend and then try to reset things on Sunday and have trouble.
Okay. So is it possible to reset or does it take some time to reset?
It's possible to reset, and our bodies are pretty forgiving, and especially REM sleep. We're, kind of understanding what REM sleep does for us. That's the dream state that can actually be reset quite quickly in 1 or 2 nights of
Okay.
good sleep. Yeah,
Okay.
yeah,
So
and
if
it's
you have,
interesting. Sorry, go ahead.
no, I was just going to say, if you have troubled sleep, to aim for at least 1 or 2 good nights or try to get to bed
Yeah,
early the next 2 nights to help yourself recover.
yeah.
Okay.
Except I would say no, don't sleep in too much of your normal wake up time.
Oh, okay.
Meaning like longer than an hour, because then it will create your sleep drive will be impaired. Your sleep drive builds as the day goes on, ideally. So by the time it's nighttime, you're like, okay, I'm ready for sleep. I'm tired. But if you sleep in, say, 2 hours longer that day, uh, it it can negatively impact your sleep drive.
Okay.
Yeah.
Okay. So for those runners out there that they started to notice that connection, that they are feeling a little bit more tired and run down and they're not getting that good quality sleep, either they're waking up really fatigued or they're just
Mhm.
having trouble falling asleep or staying asleep, what other solutions would you what kind of things have you found beneficial for your client base?
Okay, so especially for runners who are kind of what I always say to them is you're kind of seeing the edge of the cliff coming and you're running towards it. So
Yeah.
hopefully we can stop it before that you jump off the cliff, fall off the cliff. Um, the circadian rhythm is really important. I think when you eat is important too, and what you eat.
Okay.
So I usually recommend not eating anything about 4 hours before you're trying to get to sleep,
Mm,
because sleep also serves the purpose of detoxification as well as recovery. So if you've just had a couple of beers or a few glasses of wine, chips or a chocolate bar, it's going to interfere with that ability for your body just to kind of rest, and get into sleep easily. There are a certain number of people who do benefit from a little snack before, but when I mean a little snack, I mean maybe less than 300 calories, maybe some fruit and some seeds or some pumpkin seeds or nuts, something light,
mhm.
not too fatty. That can sometimes, for some people, that can be really important to kind of have a little sort of refill their liver glycogen before they get to sleep to stabilize their blood sugar. But for most people, I say the kitchen should be closed around 7 or 8, depending on when you
Okay.
go to bed.
Okay. So no food after 7 or 8
Yeah,
p.m.
especially sugary, really fatty foods and alcohol. Although some people think it helps them to sleep, it actually disrupts your sleep cycles. So it's true. You probably do get to sleep more quickly, but you might wake up the next morning and not I feel like you've slept, and you probably have slept 8 hours, but it's not as restorative.
Okay. Yeah, it's just not the same quality of
Exactly.
sleep. So if you're waking up tired, yeah,
Yeah,
that's a good point for those people that they don't have problems falling asleep, but they're just waking up so fatigued. Any
yeah.
insight into that?
Yeah, I think for some people too, it can be, you might want to explore, is sleep apnea a problem for you? Like maybe get a sleep study done. Because sometimes people think, oh, I slept 8 hours, but I'm falling
Yeah.
asleep in that morning meeting. And
Okay.
why is it happening? Or I'm really not feeling like going for the run.
Yeah.
So looking at other factors that might be interfering with your sleep. Obviously, sometimes too, sleeping with someone else in your bed. Sometimes partners find that they sleep better in separate beds.
Mm,
So there can be other things sort of just like nudging you awake. Body pain, obviously, can be a factor too. So if you're dealing with an injury, got a sore knee, every time you move in bed, you're going to be kind of woken up, maybe not entirely. So you want to look at some other factors for sure.
okay. Okay.
Yeah.
And any other tips to be able to fall asleep better?
Yeah, I think for me, a game changer was I was always a morning meditator, still am,
Mm,
25 plus years.
okay.
But adding in an evening meditation really made a huge difference
Okay.
in getting to sleep. And that could be downloading an app if you want some sort of guided meditation. It could just be, sitting, doing, just focusing on your breathing. But even doing 5 or 10 minutes of that, just having a wind down routine,
Yes.
um, you know, 45 minutes, 60 minutes before bed can really make a difference. For
Okay.
some people, it's having a hot shower, because another trigger for melatonin release is that sort of drop in body temperature. So
Mm,
if you get really hot, you have a hot bath or a hot shower, and then you go into your cool room, because your bedroom should be on the cool side to sleep well.
okay. Okay.
And that drop sends a signal to your brain, oh, it's time to release melatonin, it's time to go to bed.
Okay.
So for some
Maybe I
people,
should cool my room down a little bit. It's like the
yeah,
Bahamas in there.
yeah. I mean, everyone's different, but generally, yeah, a little bit cooler. The
Okay.
cool, yeah, your body temperature should drop a bit as you sleep.
So having the hot shower and then walking into that room, it's naturally going to drop your body temperature a little bit. Your body
Yeah,
doesn't have to work as hard to keep yourself hot, and it's one of
yeah,
those lessening that body burden during
yeah.
nighttime.
And for those runners, right, going through perimenopause, hot flashes, we know that, yeah, when your body temperature is going up and down in the night, it's very disruptive to your sleep.
Would
So
a hot shower or a contrast shower be beneficial for someone who's experiencing hot flashes?
a hot shower can be helpful. I mean, I do use other modalities, sort of supplements, herbs, diet changes to
Okay.
try to manage that.
Mm-hmm.
Yeah, that's definitely. I mean, a lot of women will say, yeah, that is definitely the number one disruptor of my sleep is hot flashes. you know,
Yeah.
moms of young kids, obviously their kids can be, you know, coming in and out of their bed and, you know, disrupting their sleep in different ways. So there, you know, that can be a lot of different reasons for
Yeah.
having disrupted sleep.
Yeah, so I guess that's a big question. Is it your hormones, right? Like, depending on what's going on in your life, what other symptoms are you experiencing? Where, like, how old are you? Maybe having your hormones checked. So either having a blood work or going in to see a qualified practitioner to see, is that the thing that's causing that fluctuation in energy and those disruptions in sleep?
Yeah, for sure. For women
Yeah.
and for men, yeah, as testosterone decreases, your sleep quality can be more fragmented. As your growth hormone, I mean, deep sleep's very important for generating growth hormone, and that depletes as we age. So
Mm-hmm.
yeah, there can be a complex hormonal picture that was definitely worth checking out, either through blood or dried urine or saliva.
Okay, great. And any other clinical pearls that you see in your practice?
With regard to sleep, I think just making it a priority, really managing that light dark cycle, and really listening to your body. You know, I think, as you said, you know, sometimes people are feeling very tired in the morning, and you know, they're like, okay, but I'm training for this race. I've got to get out and do that 10K tempo run. Uh,
Yes.
you know, and just maybe like doing 10 minutes of that tempo run, then checking in with yourself.
Yeah,
Am I
yeah,
feeling more energized, or am I actually really just tired?
yeah.
Yeah.
And which you just did a 10K, didn't you, Caroline?
10 miler in Thunder Bay. Yeah.
Oh, yeah,
So an unusual length of race, but it was a great race. I highly recommend it.
yeah.
Yeah. Yeah. I'm definitely at the back of the pack runner, but I
Hey,
do.
you're out there. You're out there. That's all that matters,
Yeah.
right? It doesn't
I'm
matter
out
whether you wear the
there.
back. It
I'm going to
matters that you're
finish the
moving.
race no matter what.
Yeah.
Yeah.
All right. So,
Um, Yeah,
so
and then obviously we can add in sort of individualized dietary advice, supplements,
mm,
some herbs. So those can help kind of, and I use them myself when I was having trouble sleeping as a bridge to really getting a hold of the daily habits that will help support your sleep in the long term. But you know, there are lots of herbs, supplements like melatonin or GABA, L-theanine. Probably
okay.
talking to a practitioner, like a functional medicine practitioner, naturopath, and nutritionist would be
Yeah.
helpful,
Okay.
to kind of to zone in on what might be best for you. But
Yeah.
there are a lot of natural options. Yeah, and
Okay.
magnesium. You know, a lot of people are deficient in magnesium, as you know. So
Mm-hmm.
adding that into the nightly regimen can also help. Um,
Yeah. Okay.
yeah.
So it sounds like there's no one size fits all when it comes down to the supplementation world, right? There's a few different options.
Yeah.
Each option
Yeah.
cater to, you know, somebody whose hormones are high versus low, or stress versus fatigue, and that sort
Yeah.
of thing. So what might be best for you? So yeah,
Yeah.
definitely reach out and talk to somebody who has some of those answers and can help you create a protocol that is more suited to your needs, basically.
Exactly. Instead of
Yeah,
just going on Google and kind of
yeah,
randomly trying things.
yeah. I mean,
Yeah.
Google's a great resource, but it doesn't dictate what's good and bad for you specific. So it's
Yeah.
good to have someone else on your team to make sure that what you're doing is safe.
Yeah, exactly. And I found that too, you know, even with my knowledge, when I was having trouble, I went to see a naturopath, for example, because I'm like, okay, if there's some blind spots that I'm having here, I'm not sure what's going to be most effective. And just having that more objective perspective is
Absolutely.
really
It's hard to
helpful.
treat yourself. And somebody who's more of an elite, they have to be really careful with what they're taking as well. It
Yes.
might be a
Yeah.
banned substance, even though it's natural. And even
Yes.
for the general public, too, even though it's natural, does not mean it does not come with potential side effects or interactions with other medications that you might be on. And even naturopaths see naturopathic doctors, right?
Yeah. Yeah, for
Doctors have
sure.
doctors.
Yeah. Yeah. Not sure
So
how good of a patient I am, but I do try. Yeah.
probably a realistic one, right?
Yeah.
So recapping some of the tips you had to give these runners: respect the routines and create that nice sleep routine, right? We tend to think about our daytime routines and not necessarily a nighttime routine, and
Yeah.
create that nice routine going into bed and aim for that 7 to 9 hour window. If you're not getting enough or you're getting too much, that could be a sign of overwhelm, burnout, fatigue as well
Yeah.
on either end of that picture. creating that nice like sleep hygiene, the dark room, minimizing that blue light exposure from your electronics, either removing the electronics completely, which would be optimal, however, not always realistic. So dimming the light on your electronics or getting those cool glasses that Dr. Myer had there. But if you are starting to shift over those sleep-wake cycles that keep the wake times similar so you don't get into a new pattern of sleep-wake cycles. Could it be your food, having somebody review your diet and stop eating, maybe a little bit of intermittent fasting, so stop eating that 4 hours window before bed, maybe like 7 or 8 o'clock, and keeping the sugars out of the diet at the end of the day, the fat and the alcohol out of the diet at the end of the day. And maybe with your meditation, if you're already practicing, implement another window. Like sometimes just giving that shift in your body, what it gets used to, can be beneficial to change the routine up. Like Dr. Myer had in the mornings and then moved it to the evenings. You're doing AM and PM now?
AM and PM, yeah.
Yeah, so she's doing twice a day, 45 to 60 minutes. And meditation has such a broad practice. I mean, there's right, there doesn't have to be textbook. There's a lot of different, just breathing and being quiet and still can benefit your nervous system. And lastly, is it your hormones? Have someone test to see if it's hormones, if it's blood sugars or something else going on. Physiologically, it might not necessarily be you. It might be something internally that's keeping you awake. So Dr. Maya, if somebody's looking to work with you, where would they find out more information? What's your website?
My website is alchemymed.com. So that's ALCHEMY med. Instagram is a good place to find me. So that's CF_Myer_ND. So it's CFMEYER_ND. There's lots of different ways to spell my last name.
Okay.
Yeah, those are probably the two main ways. Dr. Caroline Myer on Facebook is another way. And I'll be in July, I'm going to be doing a 7-day sleep challenge. So, implementing some of these suggestions, people can try them out.
Yes. And, okay. So maybe we'll try to add a link to that so you guys can all have access to Dr. Maya's 7-day sleep challenge. It sounds like something I definitely want to be. I want to be
very approachable, easy, and it's just trying to see what elements of this might actually be work well for you.
Okay. And what was that book again? Dr. Michael Bryce, The Power of When?
The Power of When.
Okay.
And if you want to take his quiz, I think it's called thepowerofwhenquiz.com.
Okay, cool.
It'll be illuminating to see are you a night owl? Are you really riser?
Adding some insight in there. Yeah, I'm going to add that to my reading list. So it was really great having you on today. Again, for those guys that missed her website and whatnot, we will add those in the notes after. So anyone that wants to get a hold of you can.
Great.
All right.
Thanks, Jen.
It was nice having you. Take care.
Bye-bye.